Good day and welcome to Living Well in Montana. This is a TV program of LIFTT, Living Independently for Today and Tomorrow. And the nonprofit organization serves Yellowstone County and 17 other counties in southeastern Montana. And today we are going to be talking about a new project and a new survey called Project Alive Montana. And I'll first introduce Jed Barton from LIFTT, and he will introduce today's guest.
Thanks, Corby. It's good to be with you again. Again, as Corby said, my name is Jed Barton, and I am the Outreach and Government Affairs Coordinator here at LIFTT. And as Corby mentioned, the subject of today's program is Project Alive Montana. And what Project Alive Montana is all about is a short-term focused effort to remove barriers to access to COVID-19 vaccinations for people with disabilities. As a matter of fact, ALIVE stands for Accessible Life-Saving Integrated Vaccine Equity. And one of the ways we hope to accomplish this is by doing a survey of as many folks in Montana as possible of their experiences with the COVID-19 vaccine and possible barriers to access. Joining me today is the executive assistant of the Partnership for Inclusive Disaster Strategies, Priya Penner. And Priya, we had Shaylin and Jervon on last week, and we talked a little bit about Project Alive. Thank you for joining us this week to talk a little more in depth about Project Alive and go over this survey that we're hoping people will take. I'm hoping that Lindsay has put the URL for the survey on the screen and can keep it there as long as possible so that people can go to the LIFTT website and follow the instructions to take the survey. So thanks, Priya. Sir.
Thank you so much, Jed and Corby. I'm so happy to be here.
All right, thanks. So again, as we mentioned, we're working on this project with the Partnership for Inclusive Disaster Strategies. Our other partners are in this Project Alive Montana are the Association of Programs for Rural Independent Living, which is known as APRIL, and LIFTT as a Rural Center for Independent Living is a member of APRIL. And at least one other Center for Independent Living in Montana, Summit Independent Living in Missoula, is partnering with us. So Corby, if you have the survey.
I sort of have the survey questions.
Right.
I will explain that LIFTT will be calling people, will be mailing out these surveys, and the surveys are completely anonymous. They take about 15 minutes, and certainly on air, it's going to be hard for us to sort of be anonymous per se, but at least what we're going to do is walk through the questions so that people can see it's fairly simple and it's not intimidating. Priya, tell us a little bit about why this survey is important.
Absolutely. So as Jed already explained, Project Alive is a partnership led by APRIL, the, of course, Association of Programs for Rural Independent Living. We created this survey intentionally to try to see where people with disabilities, older adults, and other marginalized communities are having difficulty receiving specifically the COVID-19 vaccine. Now, we talk specifically about COVID-19, and these questions are all geared to, getting at what are the barriers, right? But it's important to note that while this project is specifically focused on barriers to the COVID-19 vaccine, that these barriers exist throughout the processes for any sort of vaccine. So our intention is with this project to connect Centers for Independent Living like LIFTT with public health. And the survey is the main tool to really inform both Centers for Independent Living and public health departments on the barriers that local Montanan community members are facing.
So let's just go ahead and walk through the survey. The first question obviously is very simple, but it is two parts. So the question is, did you get the COVID-19 vaccine? Yes or no? And then the second part, if not, why? And
Yeah.
I think that's important. Go ahead.
Absolutely. Yeah. So again, we are really focusing on COVID-19 and on, if folks are receiving the vaccine or not. And, the if not why is such a key question because, again, we're trying to see what are the barriers? Why aren't people getting the vaccine? Is it a personal reason? Is it a religious reason? Or is it because they're having difficulty finding the resources to get the vaccine? Are they running into issues at the vaccination site? Are they running into issues in their local communities? And so, right off the bat, we want to hear from folks and their experiences and hear, what's the situation where you are? Did you get it? Did you not? No, we say right in the instructions on the first page, no answer is right or wrong. We are not trying to trick anybody. We're simply trying to get at the facts. What are people experiencing? And this first question is a great example of that.
So the second question is, I want the vaccine, but I feel pressured to not get the vaccine, yes or no? So we're finding that some people are pressured one way or the other?
Yeah. So, the partnership is as you're all aware, and as our co-executive directors talked about extensively in the last session, the partnership is a national organization. And so we have a pretty good idea of general barriers that people with disabilities and older adults are facing throughout the country. And what we have seen in general is, people personally may feel, unsure or uncertain of getting the vaccine, but are swayed one way or another due to their local community members. And that's family, that's friends, that's neighbors, that's people on the street. And so, that question is, just to see if that barrier, that pressure is seen in Montana. And if so, we want to be able to address that, right? We want to make sure that those who are feeling pressured to not get vaccinated are able to connect with resources that support them in their decision to get vaccinated, if that's so what they choose.
Jed, what's your experience with the disabled community in Billings?
Again, I myself was vaccinated as soon as it was possible, with my various eligibility requirements. The major public health vaccination clinics in Yellowstone County were held in relatively accessible, physically accessible locations, at the Shrine Auditorium here in Billings and at one of the auxiliary buildings at Metro Park, single floor. I mean, Cedar Hall's almost a giant barn. You just roll right in. And the public health department, Riverstone Health, and the National Guard who assisted them during the height of the public vaccination thing.
What we may find, because LIFTT serves such a large rural area, that some of the barriers might be, distance or accessibility.
Right. And we did make some LIFTT last summer as part of another project, made some phone calls to offer assistance for people who wanted to get vaccinated. And we had some success with that. I think a couple of our team members in Glendive found somebody a ride or found somebody, a public health nurse that would go to their house and give them the vaccine.
Mhm.
But and we got some interesting answers as far as why people weren't interested in getting the vaccine, and they run the gamut from religious to political to again, genuine medical advice based on their specific disability and condition. Again, that was interesting to learn some of that, good science behind why people might not be getting vaccinated as opposed to the popular cultural reasons.
Mhm. So one of the follow-up questions then, of course, is have you received your booster shot? So we'll find that out. But I think the next series of questions really address what people think about or know about COVID. And so the questions are, do you know the difference between flu and COVID-19? Do you think you can die from COVID-19? Do you think there's a cure for COVID-19? And then some of those questions that I think people are very confused about. I can't get COVID-19 again because I already have it or already had it. Or can you spread COVID-19 if you're vaccinated and boosted? So those are really sort of sometimes social issues about what people know about COVID.
Absolutely, Corby. When we, with the lead of April, when we at the partnership were collaborating on this survey, we didn't want to limit ourselves to any barriers, physical barriers that people might encounter during the vaccination process. We knew that there's all types of barriers in society, not just physical ones. And, sometimes different information we found really impacts whether or not people get vaccinated. And so, we're again just trying to get at what is the thinking in Montana with this survey? What are people with disabilities in Montana experiencing? What do they think about COVID? And then that all of this information will help us, work with public health, help connect the CILs with public health to work on how to meet those people where they're at. Again, I just want to reiterate the list of questions that you just read. There's no right or wrong answer. We're trying to see what everyone is thinking. So please.
And some of these questions are very much sort of opinion oriented. Like, do you believe that getting vaccinated means you'll never get COVID? Or is social distancing a way to prevent COVID? Is masking a way to prevent COVID? So, Priya, like you said, these aren't right or wrong answers. It's just getting a survey of what people think or feel about COVID.
Absolutely. Again, we are not trying to trick anybody. We're not trying to, force someone to do something they don't want to. We're not trying to say this is right and this is wrong. We're simply just trying to hear from Montanans with disabilities and, get the general culture of, what's the thinking on COVID, so that we can educate ourselves before working within the state and with CILs in the state to meet the needs of these individuals.
Jed, these next couple of questions I might ask your thoughts on, it specifically for our region. Do you know the difference between the different methods of testing? And do you know when you should get tested for COVID?
I'll be perfectly frank here. I know there are different methods of testing. I know that the tests that medical clinics perform is different than the tests we receive in our homes. By the way, I'll make a plug here. If you're a person with a disability and you need help receiving COVID-19 tests that you're entitled to from the federal government, please give LIFTT a call. We can help you navigate that website. But yeah, I fortunately have never been in a situation where I need to be tested. I have a notion of from others what the requirements are. I'm fortunate my little sister is a medical doctor, so she's been pretty good at keeping the family in line. Well, she does that anyway, but
so again, when we find out things like, do people know that there are free tests available? If people don't know that, that's certainly an area that we need to let them know about. I was doing some international travel, and there is a difference between free testing or something that you have to get within a certain amount of time and sort of what that costs. So there's a lot of variables.
Yeah, absolutely, Corby. I mean, I think it's important to note that with the different types of testing, it's just different levels of accuracy, right? So Jed rightfully mentioned the free at-home tests provided by the federal government. Everyone is entitled to, I believe it's now two
packages.
Exactly. Yes. Thank you. I was thinking of the word. Thank you so much. 2 packages of the COVID testing. If you're a person with a disability or at high risk, you're entitled to 3 packages. And those testings, that is relying on a less accurate method of testing that's easier to for the public to use. When you go to see a doctor, when you go to see any sort of medical clinic, that has more in-depth testing. And there's various purposes for each, right? And so with this question in the survey, again, not to trick anybody, not to say, oh, gotcha, we have the right answer. It's simply to say, hey, did you know that this is a thing? Do you know all of this information? And if not, that is 100% okay. That tells us as the project that there is gaps in where information is being held, where can be found, and how it's getting to the public. And that gap creates a barrier for so many people. If they don't know that, you should get tested for COVID if you believe you have symptoms, that could create a gap that is not found elsewhere.
One of the other questions I see is, does becoming vaccinated protect others around you? And it's always an interesting thing about the exposure to X number of people, who's vaccinated and who's not, who you're in contact with too.
Absolutely. Yeah. I think that there are a lot of misconceptions around the vaccine. And I believe that there are a lot of folks who personally believe that, oh, I'm vaccinated, I'm boosted, I don't need to do X, Y, and Z. Or the opposite, right? The vaccine doesn't work. It doesn't protect people. And so again, getting that information allows us to work with people with disabilities in Montana more effectively.
So if you're just joining us on the TV station, we are talking about Project Alive, and it is a survey that we're providing to people in the disability community to find out their opinions and thoughts about COVID vaccine. And again, there's no right or wrong answers, and it's completely anonymous survey. Jed, tell us a little bit how LIFTT is going to use this survey, or who's in charge of it.
As you mentioned, Corby, LIFTT is going to send. We've put about 400 surveys in the mail to current and previous consumers of our services across our 18 counties, and we will be following up those mailings with phone calls to, check with people, see if they got this mailing, and encourage them to complete it. We also have the survey. We have a link to the online version of the survey on our website, and we also in both English and Spanish, and we also have a printable copy, a PDF file of both the English and Spanish surveys available on our website. Our project leads on Alive are John Robinson here in the Billings office, and Nancy
I noticed when I
took
took this survey, there were some questions that I didn't know the answer to. And I think this is an interesting one. What kind of mask is most effective? And there are several choices here. And I had a mask on in the airplane, and I had to change. I had sort of a mask with a logo on that I was given by a nonprofit. And the airline said, no, you have to wear this kind of a mask. So it's like one of those things. There isn't a right or wrong answer, but it will help us understand better what people know or what information we need to share.
Absolutely. And I just want to highlight something that Jed shared, which was the survey is available in both English and Spanish. There's also large print copies in physical print copies, both in English and Spanish. And so we really, really encourage everyone to touch base with LIFTT and see if there's a format that works better for you. Please do connect with LIFTT and try to see we can connect and get this survey done, because there's so many available formats, and we really want to hear from everybody. So getting that out, sharing that is so important. I also want to highlight that it was also sent out in LIFTT's May newsletter, which was fantastic. So if you have a copy of that, is it's available there as well. And then I just wanted to say that, there's just a lot of information out there. Not everybody has access to the same information, and that is normal. And we want to see, again, what people are thinking, where they're, where potentially there could be barriers. And receiving information, receiving reliable information people can trust, and the information on specifically the vaccine, and again, no right or wrong answer, but like you said, Corby, getting an idea of what is the general consensus in the state.
One of the questions that's very specific for the disabled community has to do with if you haven't got your vaccine, why so? And some of those questions have to do with accessibility, sign language interpretation, physical access, whether it's by wheelchair, any kind of sort of assistance that is needed for people that have prevented them from getting a vaccine.
Absolutely. When we created this survey, we were trying to be as broad as possible, and give, as many possible options, while also remembering we're not going to get everything, and which is why there is a right-in spot for folks to share their own potential barriers that they've run into. Like you noted, it is, has everything from accessible transportation to sign language interpreters to physical access at the site. And we were really trying to get at what are the barriers within the process itself that are preventing people who want to be vaccinated from becoming vaccinated. And that's what this question is focusing on.
So again, on this survey, there is no right or wrong answers. It will be anonymous, but it will help LIFTT and Priya, your organization, have a better understanding of how the vaccine is seen and interpreted, or barriers for people about getting the vaccine.
Yes, absolutely.
Jed, do you know how long this survey will be going on?
That has not been at least announced to me.
So we don't have an end date for it per se.
Right, at least not currently.
Correct. We have the next I'm sorry.
We will keep people updated as information becomes available, but as long as the link is live, we hope people will take the survey.
Absolutely. The survey is going to be available for the next coming weeks. There will be ample time for folks to respond. And then, of course, we'll give folks an announcement of when we're closing the survey and an end date in which we're going to be doing so. Right now, it's just sort of we're trying to see where we are, and see how we can best utilize the survey sharing process, if that makes sense. So it's open-ended for now. There is no end date, and we will be, as Jed said, updating everybody when we have that, when that date is available.
And I might add that this survey is also available. So if someone needs help filling out the survey, you could have a family member, a friend, or a PCA helping you do the survey. So that will all be available. We are coming to the close of our program. And Priya Petter, I thank you for joining us. Jed, we have a lot of work to do in Eastern Montana.
Yep.
We have a lot of work to do nationally, absolutely.
So thank you for joining us for Living Well in Montana. This is a program of LIFTT, Living Independently for Today and Tomorrow. And hopefully you will see this program. And if you haven't been asked about the survey, please call our office or email the office, and we can help you get access to the survey. Thank you all.
Thank you so much.
Thanks, Corby.